The first thing that we do before we do anything with the car seat is we take a look at the manufacturing date and to see the expiration date. So you flip the car seat over. Most all of the manufacturing dates are at the bottom. They're either in this section of the bottom, or expirations may be in the middle, or you may have it on the side. This is a Chico seat, so it has it at the bottom all the time, okay? So it'll have the manufacturing date, it'll have the model number, and the expiration date. So that's one of the first things we look for, just to make sure that the car seat is not expired. Okay, the next thing that we will look for on the seat is we always look for the weight requirements of the seat, which are always on the side. And there is usually an indicator for a 45-degree angle on the side. So it could be a red line that's level to ground, or it could be a line that's indented in the plastic on the side. All right. Sometimes it's a bubble or a bead, but if they don't have that, it'll always be a line. The next thing that we look at and kind of go over with the family is the belt path. So the belt path is where the straps run through these insertion sites here. Let me put them up a little bit more. So this strap is on the lowest insertion site, and it attaches down here. If you want to take this strap off and move it up to the next one, all you have to do is just take it off the bar and then move it down this one, back up to the next one, and then hook it back. On a lot of car seats, they actually have two areas of stitching. The one area here and one area here. When a baby is small, you'll actually use the first area stitching so that when you tighten the baby in the seat, you'll actually get them tight enough. So that's something to look for. There's also a couple other things to look for as far as the belt path goes. There are different types of seats and adjustments. So I think in our handout we do have one seat that is kind of a newer seat that you turn the knob and the straps will go up. That's another type of adjustment. There's also adjustment on each side, and there's another little black box that you can make an adjustment with, but there are multiple adjustments that you can do and belt paths for that. All right. The next thing that we'll go over is some of the education that we give the families. I usually tell them the handlebar is down when the car is in motion, rear facing in the back seat for at least 2 years, and then just to make sure that the angle is a 45-degree angle for the car seat and position in the seat. As far as the safety in the seat, it doesn't matter, because families do ask this, what position is best for on the back of the seat, center or side. It is going to be up to the family where they need to position the seat because they may have siblings and they may need to be in the middle or the side or in a further back. So it's going to be up to the family. The only law states that a child just needs to be restrained. One more thing I want to mention is about how to evaluate the seat when there is something that does not look right to you. So there always needs to be straps coming from the back and over the hips. Occasionally, what happens is families will clean their seats before they bring them in. If they clean the seats, they will thread the straps through improperly. So you may find that the straps don't necessarily come right over the hips. I've seen them to where they'll come up in the back and they won't hook them on to the buckle down here, or that they'll knot them. They do different things with the seat, but just make sure there's a clip here, this area so that can be placed into the buckle, coming over the hips and over top of the shoulders. If it doesn't come like that, then they may have threaded it through improperly, and you just have to take a look at their manual. If they don't have a manual, and if you, I would just take it back and unthread it, and then thread it through again, and so that maybe you can do it properly the second time. And as far as that, we talk about the education, which is going to go further into positioning, and that is what Rebecca's going to go over now.
You do not want to handle the baby. You want the parents to handle the baby to put them in the car seat. You want to direct them to put the baby all the way back in the car seat so their bottom's nice and far back and their head straight up so they don't get a chin tuck position. You want to evaluate if there's a space between their crotch and the buckle. If there is a space, take a washcloth, put it under the infant's legs between the crotch and the buckle before fastening. Also, you want to evaluate if the shoulders and the straps are either equal or the straps are lower than the shoulders. If it's too high, the straps need to come down a level. If it's too low and you go up to the next strap, you want to bring it up to the next level. Next, have the parents get the baby in the car seat. If the straps are too tight and they can't, most car seats, there's a button or a metal button underneath the cloth where you can push and pull the straps to loosen. Some have them in the back. If they need to tighten, all they need to do is pull the string and it should equally tighten. Have the parents buckle the buckles. Have them pull tight around the infant's hips and instruct the parent to have finger tightness. So that means put a finger over the shoulder and pull until you got finger tight. You want the child to be snug but not too tight. Once that's done, position the chest piece over the sternum, under the armpit, around the nipple line. Now, since this baby has this extra space, instruct the parent to place rolled up receiving blankets on the outside of the positioner. Also, make sure the head positioner is back and your baby's in. Next, we'll go over putting the baby in the car seat without the positioners. Okay. Without the positioner, have the parent place the baby all the way back with the butt back. This sometimes increases the gap between the buckle and the baby's crotch. So once again, with this baby, we need to place the washcloth. Check for the shoulder straps and have the parent buckle the child in. Instruct the parent to pull tight on the hips and do finger tightness on the shoulders again. Place the chest piece in the nipple under the armpit line. Now we need to fill this space in. We only use the blankets like so. We do not use an extra blanket around the head. There are some car seats that have a foam piece that will help boost the child up. So if you see a weird foam wedge, that will go under the baby's bottom. If the parent has any questions about the base placement, please refer them to a certified provider that usually is at a police station or a firehouse. Also, before the car seat placement, make sure the baby has clothes on so the straps don't bother the infant's skin. Also, do not wear extra thick clothing like jackets underneath the straps because it decreases the safety rating for the car seat.